Hello, today my name is Ashlyn Baker and I will be the student nurse. So right now I am assessing the patient's respiratory status for depth, rate, and rhythm, performing hand hygiene. And I will assess for redness, drainage, and swelling, and I will make sure that it's been 3 hours since the patient last ate. That's what I was doing right there. And then I will, of course, position the patient up from the lying position to a semi-Fowler's position, placing a towel or linen saver over him, which is what I'm doing right here. And then the pad cover. And performing hand hygiene again. And then there is sets of sterile gloves over there that I will use throughout. There just isn't a package because I was just demonstrating. That is the already pre-cut gauze, and then those are sterile, 2 sets of sterile gloves. So I will pull this set over. As I would open them, I'm just positioning them how they would be when I open them. And then I will open from the lips of the package and grabbing the inside of the cuff, orienting myself not to contaminate. My hands were a little sweaty and my pinky kept getting caught, but I did not let go of the inside of the cuff so I don't contaminate the outside. Sliding my hand in and fix the fingers after you have both sets on. Reaching under the cuff, touching only the sterile side. Orienting and sliding my hand in. And now I can situate my fingers. And now I'm removing the pad. Of course, I would have hyperoxygenated my patient if need be. And discarding of my gloves in the biohazard bag, performing hand hygiene. And I do know you never turn your back on the sterile field, but none of these packages are opened yet. Now I'm going to begin setting up my sterile field. Opening my sterile package. Pulling out the sterile field cover. Only touching the 1-inch borders on the outsides. Laying it down. Now just orienting myself with what all is in the package, just making sure everything's there. And these are the sterile gloves that would have already been sealed. And now just putting them on after opening the package. Grabbing the inside of the cuff not to contaminate the outside sterile field, never letting go. And I will situate my fingers in a minute, reaching under the cuff, only touching the sterile side, orienting myself. Now situating my fingers. Now I'm just voicing that this would have been a sterile package that I would have opened and dumping that on my sterile field. Pulling out my sterile contents. Those are the extra set of sterile gloves. And just pulling everything out so that I can pour my peroxide and my sterile saline in there. And since the bottle is sterile, I don't have to lip it, but if it wasn't, I would be sure to lip it. Discarding of the trash in the biohazard bin, not turning my back on the sterile field. I'm going to pour that in one side. Closing it back and opening my hydrogen peroxide to pour into the other side. And I will discard in the biohazard bag or trash can. Now just organizing my sterile field. Those are both pre-cut gauze. And I'm going to dip my swabs in the sterile saline and set them on the other side of the sterile container. And dampening my gauze with sterile saline as well, wringing them out, therefore they're not soaking wet, which could lead to skin breakdown on the patient. And setting them with the sterile swabs as well. Now I was just voicing that I would have hyperoxygenated my patient, and the respiratory rate is, I did check for deep even, and now I am removing the reusable cannula, and I will be placing it in the hydrogen peroxide. I'm grabbing my spoolie cleaner, grabbing it in the hydrogen peroxide and cleaning it thoroughly inside and out, making sure I get all around the edges. And I will discard the spoolie brush into the biohazard bag and placing it into tapping it on the side and placing it into the sterile saline. And that was after I changed gloves, of course, because my gloves would no longer be sterile. And after reapplying the sterile gloves, I will reach back into my sterile container and grab one of my swabs, cleaning around the trach site, making sure there's not any excess water that could lead to skin breakdown, disposing after each use of each swab. Never using one swab more than once. And this is under the faceplate as well. And then now cleaning on top of the faceplate. Again, not leaving it wet, which will lead to skin breakdown. And disposing. Now reaching and grabbing a dry one, therefore, as I've said, to make sure I get any excess moisture, that therefore my patient doesn't have skin breakdown around the trach site. And now I'm having a coworker hold the trach site stable while I remove the ties. Therefore, I can place a new one on. Removing and discarding in the biohazard bag. Reaching and grabbing the new fastener. Sliding it in the loop so that I can tie it secure. That way I can still slide 2 fingers under it. That way it's not cutting all, not too tight on the patient, but still stable. And that's what I'm doing there. Now I will remove my soiled gloves and discard in the biohazard bag. And here putting on the gloves as if I would have just opened them. Again, never letting go of the inside of the glove, and I will situate my fingers in just a moment. And grabbing the outside of the cuff, touching only the sterile part of the glove, therefore not to contaminate either pair. Situating my fingers and hands. Now I am applying the already pre-cut gauze under the tracheostomy, and never use cut gauze because the fibers can get into the patient's respiratory tract, which can lead to serious issues. And here I have assessed the patient's tolerance of the procedure and make sure that everything is out of the patient's harmful way. I will assess respiratory rate again and just checking the stoma site one last time for any skin breakdown. And since my patient is unconscious, I cannot ask him about a pain level. I will also clean up my sterile field and then discard my gloves and perform hand hygiene. And of course, before this started, I would have worn PPE. in here, picking up the sterile field, but not to spill water everywhere. I do just allow it to sit there, but I would dispose of it properly in the biohazard bin.